the process flow. You will do till B2 in India. GOITE is the institute where you can learn the language. So you can just put this GOITE center in Google and you'll find so many. And there are many other institutes also where you can learn German language. Just make sure that, the institute is good, where they teach good German and everything. And that GOITE, I find it slightly expensive. I've learned in GOITE. I have also learned in Language Pantheon, which is based in Delhi, but they have online institutes. I'm not advertising them here, but you can just find out. This certificate is needed. To get to this certificate, you can complete the language course in 6 months or 8 months also, from A1 to B2. But I would say if you're working, if you're doing PG and then you want to learn the language side by side, it will take a minimum of 1 year. And this 1 year is not going to be that easy because you have tons of things to do in the hospital and you also have to take the class. It is not going to be that easy, but that's how it's going to be. That's how I did it, and it requires a minimum of 1 year. If at all you've completed PG and you're at home and you don't want to work and then you want to do the language, you can complete it in 6 months also, but it's going to be very stressful. And here in Germany, all the doctors, when they complete MBBS when they're at the age of 25 or 26. That's the time when they complete MBBS. So when we come here, we are seen upon very young doctors. Even though we have experience, they say, yeah, you're probably very young. I don't think so you have much experience. That's how they talk in interview. We need to prove that with our CVs and work experience certificate and that we have experience and so on. And then you will have to apply for this deficit Bescheid, which is actually the evaluation. So you send all the documents after attestation and translation. So all these documents which I showed in the previous slide, you get them attested from the embassies, German embassies in India. You get it translated by a German translator, and then you send it to the medical council. They will take some months, minimum of 4, 5 months or 6 months to send the evaluation certificate, which is called this deficit Bescheid. This is deficit Bescheid. So this entire process, when you start learning the language, you can apply for the deficit Bescheid, and everything will take around 12 to 14 months. And after you get the deficit Bescheid, then you apply for the visa. This is a 16B visa. So the application of visa and then getting the visa. Once you apply for the visa, once you go for the interview, it will take a minimum of 2 to 3 months for them to approve the visa or give a response. And after that, once you come to Germany, you will be doing the C1 special course for doctors in Germany, which is training for this Fachsprachprüfung. So there are 2 exams which you'll be giving here in Germany. One is the Fachsprachprüfung, which is a temporary medical license exam, which is valid for 2 years and where you can work only in one state. So you will be doing a course called the C1 special course for German doctors, where you will be learning specific all the terminologies, medical terminology, whatever we learned in MBBS, like all, say for example, bones, whatever the bones in the body. For rib cage, we don't say rib cage here; they have to say Brustkorb. So it's different. So all those things will be taught in this course, and we'll have to learn this one, and it'll be done in this exam. And then you'll be doing the KP exam. You'll after that, after clearing this FSP exam, you will get a temporary license with which you can start working. But the PG does not start yet. You can only start working and start earning, but your PG does not start yet. Your PG starts after completing this KP. So this KP is called Kenntnisprüfung, which is a Kenntnisprüfung and the permanent medical license exam. And once you clear that exam, then you can start your residency. You can just convert the job where you're working as your residence, and whatever you start, whatever surgeries you do starts getting counted. For example, you're working in a hospital after this FSP exam, and you're doing say for example, you're in my example. So I'm working in a trauma surgery and so on. I'm doing surgeries right now. I'm getting paid the same salary, but my surgeries which I'm doing are not getting registered in my log. It will get registered only after I finish this KP exam. And after that, every surgery I get, I can get it in the log. And then later, after that, but the salary will be the same. When you finish the FSP exam and you earn, and the KP exam you earn, it's going to be the same. So what are the exams that you'll have? First is the language exam and then the KP exam. So FSP exam is basically only history taking without examination. So you'll be given an actor, you will take the history of the patient in German language, and then there'll be 20 minutes to take the history, 20 minutes to write the case sheet. Case sheet also has to be written in German, and then 20 minutes for the Viva. The Viva will also be in German. So this is KP, it's different. So KP will be everything. It's going to be the same thing. The cases and everything is almost the same thing, like how we have learned in MBBS and all. So you'll have the same kind of cases like hernia or cholecystitis or cholelithiasis, or cardiology like cardiac failure or respiratory disease like COPD and so on. So similar kind of cases you'll be having in both the exams. But here you won't examine the patient. It's only going to test on the language, how far you know the language and how far and so on. And with the history, how are you able to get diagnosis and investigations, whatever you suggest with the history, that will be tested here in FSP. In KP, it's going to be just like the MBBS exam, but a little more of higher standards about into depth into examination and treatment and investigation.